Knock, knock, can I come in?
Sure.
Hi, I'm Valerie. I'm going to be your nurse today. I'm shutting in the door, washing my hands for some privacy. Can you please tell me your name and your birthday?
Sure, Joe W. 1233.
Thank you. So what I'm going to do today is I'm going to be checking your musculoskeletal and your strength. Yep. Now, are you in any pain today?
No.
Okay, wonderful. What I'm going to do first is I'm going to check your pulse and heart rate, and I'm going to count for 30 seconds. Okay, for the sake of this video, your respirations are between 12 and 20, and your pulse is between 60 and 100 beats per minute. Awesome. Now, before we get started, are you experiencing any pain in your joints or muscles?
No.
Any weakness in your joints or muscles?
No.
Okay, so Joe is alert. Do you know what day it is?
Yes.
What day is it?
Wednesday.
Okay. And do you know what time it is?
Yes.
What time is it?
8:40.
Great, thank you. So Joe is following commands and directions. His speech is clear. He's oriented to person, self, and time. Now I'm going to take a look at your neck here. Your skin is symmetric in coloring. There's no lesions, and it looks like your skin is intact. I'm going to have you just look up for me, please. Your trachea is midline, and then look over. Okay, yep, thank you. There's no JVD. Now what I'm going to have you do is I'm going to have you put your head in towards your chest. Okay, that's flexion, and then I'm going to have you tilt your head all the way back again. That's extension. Now I'm going to have you look like over one shoulder again. Keep going. And then look over your other shoulder. Thank you. So lateral bending is good, and rotation is also good. So he has active full range of motion in his neck. Now I'm going to palpate your neck. Is there any tendernesses or pain in your neck?
No.
Okay. Nowhere? Okay. So there's no pain or tenderness. Now I'm going to palpate cranial nerve 11, your spinal accessory. So I'm going to just put my hands on your shoulders. And I'm going to have you push against my hands. Okay. Now I'm going to push down, and I want you to like shrug into them again one more time. Okay. Thank you. So he has symmetric. Oh, I'm sorry. Cranial nerve 11 is intact. He has equal muscle strength. Now your upper extremities, I'm going to inspect. Your skin looks good. Skin is symmetric in coloring. There's no lesions, and your skin is intact. I'm going to inspect your muscle bulk, which your muscles seem to be equal. No atrophy. Now I'm going to have you, I'm just going to look at your shoulders on both sides. Okay, shoulders look good. And I'm going to look at your elbows. Okay. And let me just look at those on this side. And then your fingers. So just, okay, thank you. And then let me look at your shoulders, your elbows, wrists, and your hands. Okay, thank you. So the joints are symmetric, no signs or symptoms of infection or deformities. And now I'm going to check your fine motor skills. Are you able, with one hand, can you touch your pinky to all fingers? Quick, quick, quick. And then the other hand? Each finger. Thank you. So the FMM is intact bilaterally. Now I'm going to palpate your joints. Pain or discomfort?
No.
Okay. So there's no tenderness, no crepitus or edema. Now I'm going to check your radial pulse. Can I just see your wrist, please? Radial pulse is +2, and then I'm going to check it on this side. Radial pulse is +2 bilaterally. And then I'm also going to look at your fingernails. I want to make sure your cap refill is less than 2 on all 10 fingers, and it is. Now I'm going to have you, can you put your, can you grab my fingers? And I want you to pull. Okay, and then I want you to push me. Okay, thank you. Your 5 out of 5 bilateral scale. And then I'm going to assess your range of motion on your upper extremities. So what I'm going to have you do is, you kind of already did this, but can you flex your arms in and then extend them down? Thank you. And then can I have you put your arms up for abduction and then put them down for adduction? Okay. And then I'm gonna have you put your arms out like this. This is pronation, and then if you put your hands sideways so that your pinkies kind of touch. Yep, that's supination. So active range of motion in upper extremities. And now I'm gonna inspect your lower extremities. The coloring of your skin is equal. There's no lesions and your skin is intact. And you have symmetric muscle bulk, no atrophy that I can see. Now I'm going to look at your legs, your knees, and your ankles. Your knees, your ankles. Okay. The joints are symmetric. There's no signs or signs of infection or deformities. Now I'm going to inspect your fine motor skills in your legs. So with your right leg, I'm going to have you pick up your leg and kind of rub your shin with your heel. Yep, and then do the same thing with your other leg. Okay. So your fine motor movement is intact bilaterally, and now I'm going to palpate your legs, your joints, so your hip bones.
Okay.
Any tenderness or pain?
No.
And your knees?
No.
Ankles?
No.
Feet?
No.
Okay. No tenderness or crepitus or edema. Now I'm going to palpate your both of the tops of your feet. Dorsalis pedis is +2 bilaterally. And then I'm going to check your capri foot, all 10 toes. Oh, you can't see it on camera, can you? Those are less than 2 bilaterally. The capri foot. And now I'm going to check your strength on your legs. So I'm going to have you, I'm going to move this a little so they can see. I'm going to put my hands against your feet. Can you push out towards me? I'm going to give you resistance. And then I'm going to pull in. And I want you to pull in too. Yep. Thank you. Okay. So, your 5 out of 5 strength bilaterally. And then I'm going to check the range of motion in your lower extremities. Are you able to elevate your leg up and kind of out to the side? Like your hip, like lift your leg. Yep. And then do the side, up to the side. Okay. So that's elevation and depression. And then can I have you lift both of your legs like straight up? Yep. So that's abduction, and then put them straight down. That's adduction. And then can you flex your legs? I guess you just bent them, so that was flexation. And then when you put them back in, that's extension. And then with your foot, I'm gonna have you do plantar. So I'm gonna have you lift your feet up like this, like off the ground, and then lift like your toes towards you. Yep. And then can you put your heels down, both feet? Okay. So that was plantar and dorsiflexion. So full range of motion in the lower extremities. Now I'm gonna inspect your spine. So I'm gonna have you rotate so they can see.
Okay.
No, the other. Can you see? Okay. I'm gonna look at your skin. It's symmetric in coloring. Your skin is intact. Your posture is equal alignment in your shoulders and scapula. And your iliac crest. Sorry, down here. Yep, everything looks equal. And then your vertebrae column is midline. And what I'm gonna have you do is hyperflex. So I'm gonna have you kind of roll into yourself, like give yourself a hug. Like roll into a ball. Yep, okay, and then go backwards like you're stretching it back all the way out. Okay. So you have hyperflexion and hyperextension. And then I'm going to inspect your cervical, thoracic, lumbar spine for deformities, which doesn't look like, I'm going to lift your shirt, which doesn't look like you have any. Okay. So, and then I'm going to have you, I'm going to show you, like, lean over like a teapot. Yep. And then do the same on the other side. Okay. So that's lateral bending. And are you able to kind of rotate like almost circular. Yep, like that. And then the other way. Okay. Great. So you have full active range of motion in your spine. Now, is there anything I can get you before I grab the doctor?
No, thank
Okay.
you.
Thank you.
Thank you.